Pharmacodynamics is the study of the effects of drugs on the body, and how these effects are related to the drug's chemical and physical properties. It is a fundamental aspect of pharmacology and plays a critical role in the development and use of drugs for therapeutic purposes. In this video, we will explore the principles of pharmacodynamics, including the mechanisms of drug action, drug receptor interactions, and dose-response relationships. Mechanisms of drug action. Drugs exert their effects on the body through a variety of mechanisms. One of the most common mechanisms is through the modulation of receptor activity. Receptors are protein molecules that are located on the surface or inside of cells, and they are responsible for transmitting signals between cells. When a drug binds to a receptor, it can either activate or inhibit the receptor's activity, leading to a change in cellular function. Another mechanism of drug action is through the alteration of enzyme activity. Enzymes are proteins that catalyze chemical reactions in the body, and drugs can either inhibit or enhance their activity. For example, many drugs used to treat hypertension work by inhibiting the activity of an enzyme called angiotensin converting enzyme, ACE, which is involved in the regulation of blood pressure. Drug receptor interactions. The binding of a drug to its receptor is a key step in the pharmacodynamic process. The binding can be reversible or irreversible, depending on the drug's chemical properties and the nature of the receptor. Reversible binding is preferred, as it allows for the drug to be cleared from the body more easily and reduces the risk of toxic effects. The strength of the drug-receptor interaction is determined by the drug's affinity for the receptor, which is a measure of how tightly the drug binds to the receptor. The affinity is influenced by the chemical properties of both the drug and the receptor, including the shape, size, and charge of the molecules. The efficacy of the drug-receptor interaction is a measure of the drug's ability to produce a response once it has bound to the receptor. The efficacy is influenced by the drug's chemical properties, as well as the nature of the receptor and its downstream signaling pathways. A drug with high efficacy will produce a strong response, while a drug with low efficacy will produce a weaker response. Dose-response relationships. The dose-response relationship is a fundamental principle of pharmacodynamics, and it describes the relationship between the dose of a drug and the magnitude of its effects. In general, as the dose of a drug increases, so does the magnitude of its effects, up to a certain point. Beyond this point, further increases in the dose may not produce any additional effects, or may even produce toxic effects. The shape of the dose-response curve can vary depending on the drug and the nature of the response. For some drugs, the curve is steep, indicating that small changes in the dose can produce large changes in the response. For other drugs, the curve is shallow, indicating that large changes in the dose are required to produce significant changes in the response. The therapeutic index is a measure of the safety of a drug, and it is calculated as the ratio of the dose required to produce a therapeutic effect to the dose required to produce a toxic effect. A drug with a high therapeutic index is considered safer than a drug with a low therapeutic index, as it is less likely to produce toxic effects at therapeutic doses. Pharmacodynamic principles are essential for the development and use of drugs for therapeutic purposes. Understanding the mechanisms of drug action, drug receptor interactions, and dose-response relationships is critical for optimizing drug efficacy and safety. Applications of pharmacodynamic principles. The principles of pharmacodynamics have wide-ranging applications in the development and use of drugs for therapeutic purposes. For example, pharmacodynamic studies are used to determine the optimal dose and dosing schedule of a drug, as well as to identify potential drug-drug interactions and adverse effects. Pharmacodynamic principles are also used to design and develop new drugs. By understanding the mechanisms of drug action and drug receptor interactions, researchers can design drugs with improved selectivity, potency, and efficacy. For example, drugs that target specific subtypes of receptors can have improved therapeutic profiles and fewer adverse effects than drugs that target multiple subtypes. Pharmacodynamic principles are also used to evaluate the safety and efficacy of drugs in clinical trials. Clinical trials are designed to evaluate the pharmacokinetics and pharmacodynamics of a drug in a specific patient population, and to determine the optimal dose and dosing schedule. The results of clinical trials are used to support the regulatory approval of drugs for therapeutic use. Limitations of pharmacodynamic principles. While pharmacodynamic principles are essential for the development and use of drugs, they do have some limitations. One limitation is that pharmacodynamic studies are often conducted in vitro or in animal models, which may not accurately reflect the pharmacodynamic properties of a drug in humans. As a result, the efficacy and safety of drugs in humans may be different than what is observed in preclinical studies. Another limitation is that pharmacodynamic principles do not account for the variability in drug response that can occur among different individuals. Factors such as age, sex, genetics, and comorbidities can all affect the pharmacokinetics and pharmacodynamics of a drug, and may require individualized dosing strategies. Future directions. One area of research that is gaining increasing attention is the development of personalized medicine, which involves tailoring drug therapy to individual patients based on their unique genetic and clinical characteristics. This approach has the potential to improve drug efficacy and safety, and to reduce healthcare costs by minimizing the use of ineffective and/or toxic drugs. Another area of research is the development of drugs that target specific signaling pathways in cellular processes that are involved in disease pathogenesis. By targeting these pathways, drugs can produce more specific and potent therapeutic effects, while minimizing adverse effects. For example, drugs that target the immune system are showing promise in the treatment of autoimmune and inflammatory diseases. Pharmacodynamic principles are essential for the development and use of drugs for therapeutic purposes. Understanding the mechanisms of drug action, drug receptor interactions, and dose-response relationships is critical for optimizing drug efficacy and safety. Future research in pharmacodynamics will continue to explore new mechanisms of drug action and develop new drugs with improved therapeutic profiles, including personalized medicine and drugs that target specific signaling pathways and cellular processes. Ultimately, the application of pharmacodynamic principles has the potential to improve the health and well-being of millions of people worldwide. Practical applications of pharmacodynamic principles. The principles of pharmacodynamics have practical applications in various fields of medicine, including but not limited to cardiology, neurology, oncology, and psychiatry. For instance, drugs that target specific subtypes of receptors have revolutionized the treatment of heart failure, hypertension, and angina. Beta blockers, for example, block the effects of adrenaline on the heart and reduce heart rate and blood pressure, thereby improving cardiac function and reducing the risk of heart attack and stroke. In neurology, drugs that target neurotransmitter receptors have improved the treatment of various neurological disorders such as epilepsy, Parkinson's disease, and depression. Anti-epileptic drugs, for instance, block the activity of glutamate and enhance the activity of gamma-aminobutyric acid, GABA, thereby reducing the frequency and severity of seizures. Similarly, antidepressants target serotonin and/or norepinephrine receptors to alleviate symptoms of depression and anxiety. These drugs act by increasing the availability of these neurotransmitters in the brain, thereby improving mood and reducing anxiety. In oncology, pharmacodynamic principles are used to develop and evaluate anti-cancer drugs that target specific molecular pathways involved in cancer growth and metastasis. For example, targeted therapies such as tyrosine kinase inhibitors and monoclonal antibodies have improved the treatment of various types of cancer, including but not limited to breast, lung, and colon cancer. These drugs block the activity of specific proteins that are overactive in cancer cells and promote their proliferation and survival. While chemotherapy is a broad-spectrum treatment that can affect both cancerous and healthy cells, tyrosine kinase inhibitors and monoclonal antibodies are targeted therapies that under ideal conditions would specifically target cancer cells. In psychiatry, Pharmacodynamic principles are used to develop drugs that target various neurotransmitter systems involved in the regulation of mood, cognition, and behavior. Antipsychotic drugs, for example, block the activity of dopamine receptors and reduce the symptoms of schizophrenia and bipolar disorder. Antipsychotic drugs work by blocking the activity of dopamine receptors in certain areas of the brain, which can reduce the symptoms of schizophrenia and bipolar disorder, such as hallucinations, delusions, and disordered thinking. These drugs are sometimes referred to as dopamine receptor antagonists. Similarly, stimulant drugs such as methylphenidate and amphetamines enhance the activity of dopamine and/or norepinephrine and improve attention and focus in patients with attention deficit hyperactivity disorder (ADHD). These drugs are sometimes referred to as dopamine norepinephrine reuptake inhibitors or dopamine norepinephrine releasing agents, depending on their specific mechanism of action. Challenges in pharmacodynamic research. Despite the potential benefits of pharmacodynamic principles in medicine, there are several challenges and limitations that researchers face in the study of drug action and receptor interactions. One of the challenges is the complexity and heterogeneity of biological systems, which can affect the reproducibility and reliability of pharmacodynamic data. For instance, the activity of drug metabolizing enzymes and drug transporters can vary among individuals and affect the pharmacokinetics and pharmacodynamics of a drug. Another challenge is the development of drug resistance, which can occur when the target receptor or pathway undergoes mutations or adaptations that render the drug ineffective. This phenomenon is particularly common in the treatment of infectious diseases and cancer, where the evolution of drug-resistant strains or clones is a major concern. This can happen due to genetic mutations or the selection of resistant strains of microorganisms or cancer cells. In the case of infectious diseases, the misuse or overuse of antibiotics can contribute to the development of drug-resistant strains, while in cancer treatment, drug resistance can develop as a result of the genetic instability of cancer cells and their ability to adapt and evolve in response to treatment. Moreover, pharmacodynamic research requires advanced technologies and methods, such as high-throughput screening, computational modeling, and advanced imaging techniques, which may not be accessible to all researchers or institutions. Therefore, collaboration and sharing of resources and data are essential to advance the field of pharmacodynamics and improve the development and use of drugs. In conclusion, pharmacodynamic principles play a critical role in the development and use of drugs for therapeutic purposes, as well as in the study of biological systems and disease mechanisms. Understanding the mechanisms of drug action, receptor interactions, and dose-response relationships is essential for optimizing drug efficacy and safety, and for developing new drugs with improved therapeutic profiles. However, researchers face several challenges and limitations in the study of pharmacodynamics, such as biological complexity, drug resistance, and technological requirements. Therefore, continued research and innovation are needed to overcome these challenges and improve the health and well-being of patients. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. Please like, share and subscribe.